My friends, it is such a pleasure to say welcome, Red Hoffman, to Grief is a Sneaky Bitch podcast. I'm so glad we're finally getting together to have this conversation.
Oh, Lisa, thank you for having me. I'm so excited to be here. Thanks so much.
It's amazing. Well, listeners heard at the top of the show a little bit about your biography, which I don't know about you, but it always feels weird. Like, how do you sum up all that you want to say in a little short bio? But such as it is, they've gotten a little taste, and that means they know we're going to dive into some really important, serious, necessary topics. Sometimes, as you and I were talking about, off-air topics people don't talk about. There's a lot of taboo, which causes a lot of isolation. But we're going to talk about traumatic death. We're going to talk about death by suicide. We're going to talk about gun violence. We're going to talk about all kinds of things. And so I just name that not as a turn off your podcast station now, but as a make some space for yourself as you sit down and give yourself permission, right, to be and hold space together in our conversation. And whether it's touched your life personally or just because you're a citizen of this world, and so you know it's touched the lives of people you love, I really want us to practice being with these hard things. And as a previous guest, Dr. Joanne Cacciatore says, building the musculature, the emotional musculature of being able to hold space and be with these hard things, because that's what's required of us really as humans. So I just wanted to take a little extra time in our conversation as we start today to like lay that groundwork and hold that container. So we're going to dive in, Red. Because I think you're a listener to the show, so you won't be surprised that I'm always just trying to unpack little by little the grief beliefs that we each learned as part of growing up in a culture that is grief avoidant, or as I sometimes refer to it, grief illiterate, and trying to trace some of that back to what we learned in our childhood. So I'm wondering if you can recall an early loss. It could have been in your childhood or maybe your young adulthood. And what was it? And maybe more importantly, how are the adults in your life modeling explicitly or implicitly what grief, quote unquote, should or shouldn't look like? And what do you think you taught that version of you, that younger version of you?
Well, thank you so much for asking. I was thinking about this a little bit last night. And, my grief journey, that is what I call it now,
Yeah.
started when I was 12 years old. It was 6 weeks before my bat mitzvah, I remember, when we got a phone call. It seems like a lot of my life has been about phone calls and bad news.
Yeah.
And it was news that my paternal grandfather and paternal grandmother had been in a car accident. And my paternal grandfather died at the scene. And my paternal grandmother ended up being hospitalized and was then put into rehab and broke her hip. And she died 7 months later. And that was like my first experience of grief. So I was 12 and then 13. And then 2 or 3 years later, my maternal grandfather died very suddenly. And then I think another 2 years after that, my maternal grandmother died. So from 12 to 17, I lost all my grandparents. And then we could talk about my dad's loss later. But that was kind of setting the stage. I'll say that I still have this, it was one of the few times I saw my dad cry. He was definitely an emotional person, but he just didn't cry very much. And it was one of the first times I saw my dad cry. And I certainly remember as my mom's parents were dying, so much emotion from all of my family. So I think that certainly my family did a good job expressing emotion, but my biggest memory when I look back, and this certainly went through my father's murder again as well, was having these feelings and not having the ability to articulate what I was feeling. And certainly part of that is age, because, our brains are still developing. We just don't know how to talk about any of our feelings when we're teenagers,
Right.
but we're feeling all
Exactly.
this angst inside. And struggling with that, and yet not even knowing how to ask for help because I couldn't even tell you what exactly was wrong.
Yeah.
And I think, like I've heard other people say in the show, my parents certainly did like the best they could do. When I look back and think of all that loss over such a short period of time, it's quite striking to me now when you think that, we could grieve one parent for a lifetime, but to have grieving like 4 parents so suddenly is just kind of, it was a lot. And I think the one other thing I'll say, which is also a theme, was that feeling of feeling isolated. Because again, when one can't speak about their feelings, it's hard to create community around it. And
Yeah.
then another theme that's very personal to me is feeling like it was too much. Like it just seemed like I felt like, and this is a theme of being maybe a woman and like a loud woman, always being told I'm too loud, I'm too pushy, I'm too much. And so suddenly these stories felt like too much too. It wasn't from the beginning that grandparents dying in a car accident. It's not a quote unquote normal death. It's a traumatic death. And while, you know, um, those are certainly common, like the more common death is what I would call a natural death. And so right away it was
Yes.
different.
Yeah. Yeah. Well, I appreciate many things about what you just shared, one of which is the compassion, that you have maybe in retrospect for your parents,
Yeah.
for the kind of volume and the intensity of the losses that they faced one after the other, and to recognize that, sort of they did the best they could, A, given the circumstances, but again, B, that they grew up in the same culture that doesn't really encourage that. And then that too muchness, which maybe we'll talk about going forward, I can imagine through the theme. I think a lot of us have internalized that message too. Like we feel we're too much, but also we feel, even if we could find the language, that based on the explicit or implicit responses from other people, right, that our expression is too much to hold. And so then we sort of, close in on
Yep.
ourselves. And as I've talked with so many guests, my conversation with Dr. Joe is fresh in my mind. But that closing in on ourselves as opposed to being with or opening towards ourselves then causes that its own layer. And then we become the kind of people who also don't make space for others. So thank you for sort of allowing us to be in that time, and also just pausing to just hold all of your grandparents in our
Yeah.
collective hearts. That's a lot of loss too for a teen, right?
Yes.
For a teen, as you said, who we do not have language for much, although we're sassy and talkative when we're teenagers, but to not have the language, and to not, which makes you feel lonely. And also, I wonder if you can sort of step back into red, teenage red,
Mhm.
but also in that, the job of a teenager is to individuate, is to be on your own and to figure stuff out on your own. And that can feel hard when what we're really, the intuitive knowing that we have when we're grieving, is to lean into people.
Yeah. And also, I think as a younger person, like I said, I felt like my parents definitely emoted, but it's uncomfortable when you see your parents cry and you
Yeah.
don't, it's
Yeah.
yuck, and
Yeah.
it was just like, and there's so much angst, I had a lot of angst, particularly like, as I
Yeah.
got older with my parents. So it wasn't like I was wanting to connect so much. It was
Yeah.
just a lot of uncomfortability. It's so interesting to me because now my mom and I cry very freely with each other and it doesn't feel awkward, but it just was like, I just didn't know where to put all this stuff, I did not know where to put it. And I think like many teenagers, many women, man, I just turned it in. I mean, I just
Yeah.
kept turning it in and it created a lot of chaos inside that
Yeah.
then
I
came
think,
out in all other ways. Yeah.
which is just yes, such an important reminder. I do think women, but I just think all of us, that's a cautionary tale for all of us, is that grief needs to be seen and witnessed and attended to. And so you can choose to put it away for a while, but it's always going to come out. And the more you put it away, the more it's going to come out, in sideways ways often, um, that aren't particularly useful to us, right? Or
Yeah,
other,
that
or those
definitely don't
around us.
always serve our higher selves, I
No,
mean, like
absolutely.
it's interesting, like, because I did a lot of internal family systems therapy, like later on in life. And I think I ended up having a lot of compassion for all those parts of myself that
Yes.
some of which were created during those teenage years with all that grief. And I see how I feel so loving towards all of them because they really were
Yes.
just trying to protect me. But at the same time, they were definitely chaos agents, and that ended
Yes.
up making my life really challenging.
Yes. Yes. Oh my gosh. Well, we could go have a whole hour conversation on internal family systems. And I've certainly had folks on the show about that. But to that point, which is when we reflect back, if you're a listener and you're reflecting back on maybe grief that you hadn't attended to in your younger life, or, because a new loss has happened, it's having you examine an old, to just like you had that compassion for your parents, to turn inward and have that self-compassion for those parts of us, as we talk about in parts work, or just those versions of us, teenage us, who did the best we could to keep
Mhm.
ourselves safe at that time. It's just that they're now still behind the steering wheel and we don't need them to be in charge anymore. They can, take a back seat for a
Yep.
while. And so just if you're listening and that resonated with you, just to remember to always bring in that compassion for, we're always doing the best we can with what we have at the time. And part of what I do in the work that I do, from writing and working with individuals and talks, et cetera, is inviting us constantly to check inwards, to pause, to turn our self-awareness inward, and to recognize, are the stories that we're telling ourselves, right? Are the behaviors that we're choosing, they might have been serving us, but are they serving us now?
Mm.
And without judgment, just
Yep.
be curious, right? And just to hold that. And I know, unfortunately, sadly, like many people in this country, unfortunately, have experienced after those losses at least two very traumatic um, death losses that invited you again and again over time to figure out and turn towards that loss. I
Yes.
wondered if the degree to which I always invite people to tell their lost stories is in as much detail or as little detail as you want. Reminding all of us that we're not here to be a reality TV, and yet I want us to get more comfortable talking about hard things. So I posit that or offer that to you, in helping us understand what it was like, with the death, with the murder of your father. And if you can just position it, were you already a surgeon? Like, where was that in the
Sure.
scheme of your also professional career, which now intersects with death and dying because of your hospice and palliative work as a surgeon? So,
Yeah.
yeah.
So with my dad, I was actually 19 years old.
Okay.
My dad and I had a very special spiritual connection. And I'll tell you, I don't know how I knew, but I knew that man was going to die young. In fact, when I was a teenager, at some point I had him, I just smiling because I love this picture of him, but he had gotten these like, like they used to do, like, I mean, back in the 80s, they do these like photos of people at work, like just,
Yes.
oh my God, so different than now.
Yeah.
But just this very professional photo. And I had him, I said, put a message on the back of it for me in case you die. So I have it. And it said, to my redheaded individual, I love you, love dad. And I always say my dad he just intuitively knew how to handle my like curly haired brand of crazy. Like he just got me
Yeah.
and never gave up on me. And so, beautiful story with my dad. 10 months before my dad was killed, I was like in a bad state, kind of, I said, acting out all over the place. And I overdosed. And, the morning that happened, my parents were very, very angry with me. I was on a semester break after my first semester of college. And, he happened to be randomly home from work that day. And like my dad, such a good man, he was going out and he came up to check on me and he found me and, called 911. And he certainly saved my life. And like we had this just intense
Wow.
connection that, sometimes I didn't necessarily appreciate it then. Um,
Of course, because you were a teenager and,
yeah, yeah. But it kind of set me on my rehab journey and everything. And when my dad was killed, I was 10 months sober. And I mean, I remember I got another phone call, and it was the police. I was living in Delray Beach, Florida. It was the police calling me because my old aunt and uncle lived in Delray Beach, Florida, and they were so upset. They wanted to come over and tell me in person. Someone had called them, and they got like so turned around that they like couldn't find my place. So the police called me, and my uncle got on the phone, and I just remember for some reason I thought it was my mom. Is my mom okay? Is my mom okay? And then it was my dad. And I remember that scream, a scream that I have said I've heard many times in the hospital now, just that real
Yes.
guttural,
Primal.
yeah, like
Yeah.
just couldn't believe it. And then, um, my another uncle called me and told me what happened. And what happened is my father was a mechanical engineer working on a gas pipeline between Egypt and Israel. And he was in Cairo, Egypt that night. And he was out to dinner with his two colleagues, one of whom, Bob, also was killed, and another one, Merrill, who survived, who I still talk to. And, as Meryl shared, they finished dinner, and my father got up to, I guess, put his jacket on and to get up to leave. And this guy was sitting right behind him and shot him. And Meryl always shares, which just breaks my heart, that my dad's name was Kobe. And he said Kobe just had like this look of surprise on his face, like he just didn't know what hit him.
Yeah. Yeah.
And so yeah, he was murdered. He died died on the scene, and his friend Bob died was transported to the hospital, and I think died in the hospital. And Merrill, I don't know how, but he survived, and he's still alive, which is it's gotten to be an old man, which I just love.
Yeah.
And that really started an insane grief journey, because
Yeah.
from the beginning, everything was, very traumatic in another country. It took us 5 days to get my father's body home. For like Jewish listeners know, people like Jews
Yeah.
like to put their people right in the ground. And so like there was this, that's, the next day in let's say Shabbat.
Yeah.
So it took 5 days to get him home with a lot of work from the State Department. And there was a lot of fear right away, a lot of unknown. We didn't really know exactly what happened. My dad was murdered by an Islamic fundamentalist who was screaming Allahu Akbar, which, is a beautiful thought. God is great, but
Yeah.
that's not my understanding of God's
Yeah.
greatness.
Right. Is
And so I've
murder.
struggled
Yeah.
with that, because it's just like, I don't want those words to take away from something that's also very beautiful, but it's also a call to chaos. And like that
Yeah.
was, probably one of the last things my dad heard. Um, and that kind of chaos stayed for many years, because one, no one really knew exactly what had happened. So we had like security at our house for a while, and then went through the got my dad's body back, went through the funeral, and there was a lot of news coverage, because you have to think back to 1993. There were very few people in the global north who had been affected by terrorism. So it was a very weird situation, very different, than what happened, than kind of post 9/11. It was just it was a very different story,
Yeah. Yeah.
so much unknown.
Both, I would say, global violence and gun violence, and even national gun violence is just very different.
Yeah,
Whereas now we're inundated,
it's almost
and frankly,
normal.
unfortunately, numbing ourselves out from the normalcy of it. But to
Yeah.
your point, it was, which also means it's on the news. And remember, we couldn't turn a million channels back then either.
Yes.
So I imagine then you don't know when it's going to show up in your face.
100%. Yes. And
Yeah.
I actually had that experience a couple years later. So my dad was murdered. The man who killed him was, I think for political reasons, was not really tried. He was declared criminally insane, and was placed in an institution where he had a lot of leeway. And 4 years later, almost to the day, I think 3 weeks shy of 4 years, he was let go or escaped from where he was held. And he and his brother then like basically blew up a bus filled with German tourists and killed 9 tourists and their bus driver. And I remember my mom calling me and saying to me, like, be careful, when you read the paper this morning, because like on A3 of the New York Times, there's like this story, and it
Oh
brought
my
it back
gosh.
up again. And it was just that the same feelings of just feeling unsafe, the reminder that lightning sometimes does strike twice in the same place. So all the feelings
Yeah.
of safety concerns that I had kind of lived with me for 4 years were kind of blown open. And that same feeling of feeling very isolated and too much. I mean, like, are you freaking kidding me again?
Yeah.
You just, and again, I mean, I then at that time, I think it was 23. We're still young. You know, my social circle was young. It was like there was so much that it was too much. Like people really didn't know what to say, you know?
Yeah. Yeah.
Um,
Well, I think a couple of things comes to mind. First of all, none of your peers have experienced this once, anything like it. And you're not really talking about it. And also to your point is this, too much too soon is how I think about describing trauma, right? That's one way to
right.
describe trauma, but also it's like globally too much too soon. And your poor body, it really was reacting, I can imagine. And talk about a grief trigger. I mean, it makes you even not want to use the word trigger there, but to have this other reminder that this person who out of the blue, completely rocked your world and changed the trajectory of your life now
Here he
had
is
the
again. Yeah.
here he is again destroying so many other lives too. Yeah.
And, you were talking about how TV was so different at that time. About a month after that happened, my mom, uh, I was living in Florida at the time. My mom was in New Jersey, and we met in Portland, Oregon, where I was interviewing for naturopathic medical school. And actually thought that I had dreamed this a couple of years ago. I actually asked her, did this really happen? And
Yeah.
it did really happen. I turned on CNN. My dad's murderer was on at the exact time I turned on when I was with my mom, who I probably saw once a year at that time. I turned on CNN, and my dad's murderer is jumping around in a cage in the middle of the courtroom in Cairo. And it was just, you can't even put it into words. It was like, I don't even remember like we were trying to remember what our reaction was. It's like stunned into silence. Like, are
I
you
was going to say probably maybe
like,
dissociation
yeah.
and just checking out. Yeah. I mean, such a trauma. And also I'm wondering too, when you look back at the time, had you managed to stay sober those years,
Oh,
those
yeah.
intervening
In
years? Yeah.
fact, I have to just share the first phone
Yeah.
call that I did was to a friend of mine. And I said, what do I do next? And it was like, well, just go to a meeting and help others,
Yeah.
I mean, it was just like typical
Yeah.
back to basics, Yeah.
Yes,
Yeah. Yeah.
exactly.
Yeah.
Yeah. One foot in front of the other. And also though, I'm wondering, because now I know you were just alluding to, you got into palliative medicine, and natural, like I forgot why I'm
Yeah.
blanking on
I
the word,
started as
but
a
a natural
naturopathic doctor. Yeah.
naturopathic
Yeah.
doctor,
Yeah.
but you've gotten into being a trauma
Yep.
surgeon, trauma, palliative hospice. But at that time, as a 23-year-old, and again, I'm trying to think of what year that was, trauma was not in the common vernacular, let alone trauma informed treatment the way it is now,
Not at
even though
all.
we still have a long way to go. But so were you even identifying this as traumatic grief? Did you have the language? Were you getting help from that lens at that time?
No, I will tell you, my father worked for the same company his whole life. In fact, I recently just reconnected with his boss. He worked, and they took real good care of me. They paid for my therapy for years. I mean, I can't even imagine that happening now. But
Yeah.
I will
No.
tell you, no, my therapist had no idea. I had two different therapists around that time. Neither of them knew what to do with me. And I think a lot of the therapy was more focused on the behaviors because, of course, instead of using substances, I was using food. I just was like, I did not know what to do with my feelings. And I made
Yeah.
myself really sick for, I'd lost probably a real decade of my life to being sick with an eating disorder, which was certainly like so much of my grief was put into that eating
I was just going
disorder.
to say you can draw the
A
line sort of
100%. Yeah. Yeah.
between those two things. Yeah.
Yeah. So, I mean, I think I was trying to do the best I could. I knew I needed therapy, but I wasn't getting the same help that I got after my boyfriend's death on any level. And part of that I think is, it's interesting. Part of it was the time and
Yeah.
not, perhaps trauma informed therapy, really wasn't a thing. And then part of it too was, again, because I didn't have that language, I didn't know what to ask for. Man, now I can tell
Yes.
you, I need to work on this thing and I want to use this therapeutic intervention. But
Yeah.
now I'm sitting here at 50. I was just in my young 20s. I just didn't know.
Yeah. You were in your young 20s and you didn't have the language. And also I always think about like, why is it on the griever or the traumatized person to have the language to ask for the help? And also to your point that wasn't, the therapeutic practice of the day. It was
No.
very, that kind of trauma informed thinking, especially, it was like maybe working with, Vietnam vets, maybe, right? But not the sort of common everyday violence or other traumatic grief that folks were. And you alluded to this other very tragic loss in your life, which was the death by suicide of your boyfriend. And yet I want to help us orient a little bit. There you were doing your best to get the resources you could to grieve, maybe not grieving how you would want to grieve now, but grasping at the tools from, AA or recovery and therapy, making your way through naturopathic medicine. Tell us a little bit about how you,
Yeah,
though, ended up with hospice, palliative, a trauma surgeon first, and because,
sure. So
it's a different path.
I think all of my grief led me to where I am today. I used to do a real, I'll just I just want
Yeah.
to put this in there because I used to do real mind games. Well, would I choose all of this good that happened or would I choose my dad being alive? I used to torture
Right.
myself, which is that's not how the world
False
works.
choice. That's
Yes,
not
I mean, my
false
dad's
choice.
dead and there's nothing I can do about it.
Right. And
Um,
so how do I want to live? Those two
and
things
what
are,
meaning can
yeah.
I potentially make of this? But what I'll say is, my grief really manifested in real physical form. We're very, very sick with eating disorder, in and out of treatment. And because I got so sick, I really started looking into more natural alternatives. And that's how I got introduced to naturopathic medicine. So my
Yeah.
grief really led me into this career of being a naturopathic physician. And so I trained for 5 years to do that. And in the midst of that, I just fell in love with medicine in general. And I realized that I really wanted to practice as a medical doctor. When I went to medical school, I knew that I wanted to be a surgeon because of some experiences that I had in the operating room in India. I, and through medical school, I got very interested in trauma surgery and insanely interested in end of life care. I kind of was always obsessed with death and dying, even before my grandparents died, and then had all
Yeah.
this loss. And I found that I just had the ability to sit with people and their crazy stories. They did not freak
Yeah.
me out because I felt like my story was so crazy. So I could just hold space for people's
Yeah.
emotions and for all the chaos that sometimes comes with not just traumatic death. I mean, natural deaths and illness can be insanely chaotic.
Yes.
And so I was very, very blessed. I went to naturopathic school in Portland, Oregon, and right up the hill was the medical school, OHSU. And, you know, for people in the death and dying world, they Oregon's really, it's well known. One, it's the birthplace of death with dignity. And
Yes.
two, it was OHSU is the birthplace of the post form, which is physician's order for life sustaining treatment. And the importance of both of those is that death and dying were part of the conversation every day in our medical school. And, it's not about whether you want physician assisted suicide or whatever. It's more that death and dying were at the forefront. And I remember someone
Yeah.
telling me the reason why palliative care is so good here is because if we're going to offer something as quote unquote radical as, medical aid in dying or physician assisted suicide, whatever you want to call it, we need to offer the full spectrum because we don't want people to choose that because they're not getting other great end of life options
Right.
or
Palliative support
yeah,
or
or
hospice
chronic
support.
illness options. And so it was just baked into my education. And so during medical school, I had wonderful mentorship in the trauma program, and then ended up doing really what turned out to be a life changing 1 year, 1 month rotation with the palliative care team, this award winning palliative care team at OHSU, and it changed my life. It certainly got me through my surgical training. Where I did my surgery training in Phoenix, Arizona, there was no palliative care team in the hospital. So I did what is called primary palliative care, which is the basics of palliative care that really any provider, any physician or PA or NP should be able to do. Good goals of care conversations, basic symptom management, learning how to talk about code status, and having a basic understanding of hospice. And so I got to just work on those skills throughout
Yeah.
surgery training, which was wonderful. And I think people recognize that, I think everyone has a superpower. And I think in surgery training, my superpower was in the intensive care unit having these really difficult discussions with patients and their
Yeah.
families.
Which
And
is so powerful. I just want to
yes,
pause there for a minute because we've had like Dr. Sunita Puri on
yes,
this show. We've had Dr. BJ Miller. We've had folks in the palliative and space before. And just as a reminder, palliative is really about the quality of care and life and those important conversations. And but I think I really want to draw out for listeners who aren't in the medical community to understand how different this is for most medical training, which is so focused in this binary way that we are culturally, shows up in medicine too. It's survival, survival, fix, fix, survival, survival, which of course we want our surgeons
of
to help us
course.
survive if they can, and our physicians. And that isn't always the case. And so, but that sort of drumbeat means for most medical training, although I think it's changing. Again, folks like Dr. Sunita Puri is helping lead the way among many other incredible physicians, yourself included, but that it's not that common. And so most medical students and then physicians are not equipped with those basic conversations, which then come at a cost to the patients and their families who are being forced to live with things they don't need to or make decisions that aren't really decisions that they actually have to make. Does that
Yes,
sound right? Yeah.
well, it's exactly the same thing that you just said to me when I was saying I didn't know what to ask for my therapist so many years ago.
Yes.
And why should the patient or the griever going to therapy be having to ask for what they need? And that is
Right.
the same thing, regardless of what field of medicine you're in. The patient shouldn't have to be driving the ship. Like, certainly
Yes.
if they want to, that's great. But a lot of times they don't want to be driving the ship because they're like lost at sea, and they don't even know how to swim. And so
They don't
it's,
even know what they don't know. I mean, having been
yes,
both a patient very recently as a breast cancer patient, but also, watching my husband go through his cancers, like you don't even know what you don't know.
right.
So for the burden to be on the patient to bring up
S-
these conversations is absurd.
100%. And yet that's what happens often.
Yeah.
Although I will say, I do think it's continuing. Like, I look at my huge community hospital that I work in, and it is continuing to
Yes.
change. But I think it is incumbent upon the physician or advanced practitioner who's taking care of these patients to really lay out the whole story, and also to say, in my experience, in my X years of experience, this is how I usually see this story end. I
Yes.
have no agenda for you. It could go this way or that, but I just want to tell
Yeah.
you what I see when I'm standing here. I think it's important for them to hear that. And then to, like, do you want to talk further about this situation? And
Yeah.
that is, although you were sharing before, like, kind of learning how to exercise these muscles to have these difficult conversations around grief, particularly when it's like messy grief. It's the same thing that medical providers need to
Yes.
do. We have to, like, strengthen these muscles. We have to learn over time. And it's just by watching and then by
Yeah.
practicing, because it's the practice of medicine.
And fumbling
Yeah. Oh,
and
100%. Yeah. I
and being
mean,
awkward and getting it wrong and then
yep.
learning from that. Just like, I mean, the same applies to grief supporters who say, I don't know how to show up for my friend. It's like, I don't want to say the wrong thing. And my answer is always like, you're going to say the wrong thing. You're
Yep.
probably at least once going to say the wrong thing. And then you're going to own it and you're going to apologize. And then you're going to listen. And then you're going to say things that are helpful, or more importantly, just be silent and accompany the person. But like, yeah, we're not going to learn by doing. So you're seeing a growth in the palliative community, but are you seeing a growth in non-palliative
Oh,
physicians practicing that muscle, or
yes. No, I
working
see
on
a
that?
growth.
Yeah.
I actually see a growth in, like, when I think of my hospital, I think so many of the physicians in my hospital are doing their own primary palliative care, because for
Okay.
those in the non-medical world, you probably don't know, there's never going to be enough palliative care providers,
No.
ever, ever, ever. This is incumbent upon every physician, nurse practitioner, physician assistant to learn how to have these conversations, because we're
Yeah.
all going to be taking care of patients who are going to need some support, either in chronic illness, like life altering or life limiting, or a true end of life. So no,
Yes.
I
Yeah.
see that like the culture in my hospital has changed over the years because of lack of availability. The palliative care team's just too
They
busy,
can't
you
just
know?
call in like, I don't want to have this conversation. Let me call in the team.
No,
And
that's not
sometimes
okay
there's not
anymore.
enough.
Yeah.
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 I mean, I've had also, chaplains and social workers. I'm thinking of like June Park and, Rachel Carnahan Metzger and others. But again, even that, some hospitals might have one chaplain and
Yes.
one social worker on rotation. They can't possibly, attend to the bed. So you really found your calling in that, of course, you knew what it meant to be in grief and to be in that place of fear, but also that you had this sort of intuitive comfort in being in the presence of and holding space and bearing witness, which has been my sustained meditation for most of my life, to be honest. And so that felt like a calling to you, plus presumably the surgical skills and whatever is needed. What were you learning in those early years of your practice, and help us understand how, at the timeline of how that early practice as a hospice
Sure.
palliative trauma surgeon, which I'm not sure I've ever heard of that combination of titles together, intersected with this next profound loss in your
Yeah.
life. Yeah.
Well, as I was kind of nearing the end of my surgical training, my surgical residency, it became clear to me that I somehow wanted to combine these two fields of medicine, surgery, particularly trauma surgery, and then hospice and palliative medicine. And, the combination certainly existed. There's a woman, Ann Mosenthal. I call her like the mother of surgical palliative care. She was been doing this work like since the mid 2000s. And I learned one of the very important lessons of my life, which is it's all about showing up. And so I knew she was going to be at this meeting, and I called her assistant and I said, "Can I come to this meeting?" She's like, "Sure, just show up." And like I sat at this table, and like I've shared with my residents, once you're at the table, everyone just assumes you're supposed to be there. And that was
Right.
really the beginning. I met all of these other surgeons who were
Okay.
already, had years invested in this field of combining surgery and palliative care, and then chose to do a trauma fellowship. So, like after your residency, you can do extra
Yeah.
training called a fellowship. So, 1 year of a trauma fellowship, and then I did another year of training in hospice and palliative medicine. When I was done with my training, I was very active in the American College of Surgeons and other national organizations, and started a podcast, a surgical palliative care podcast, where I was really excited about interviewing all the leaders of the field in both palliative care and in this mix of surgery and palliative care.
Yeah.
And I kind of like everyone's career, it kind of just worked itself out. At the beginning, I did almost all surgery, and a tiny bit of hospice. And then over the years, because of other things that have
Yeah.
happened to me, I've been able to kind of shift. And now I'm more 50-50, because it kind of
Okay.
suits where I am in my life right now. Yeah.
Yeah. Yeah. Um, I just love that, because I think it's just really pushing an unusual perspective. I've talked much on this show, though I have many physician friends. I have a lot of medical trauma, and so I talk often, I try to be kind, but about the sort of the ways in which doctors, particularly, I would argue, maybe you can help me understand differently, surgeons, by the very nature of the training, are sort of taught to have a kind of expert, supersized ego,
Yes.
fix it, complex. I can't ever be wrong because I can't risk being wrong because the stakes are so high. And how that often, even if they wanted to, really comes into conflict with what so many of us are asking of our physicians and our providers, is to be human and to be curious and to acknowledge when you don't know what you don't know, and to be, and and so for you to, and sounds like many peers, to sort of marry those two things together is just such an interesting, and in my imagination, hopeful way of thinking about a future of medicine that is very different. Yeah.
Yeah. I'll say, I think, every surgeon is different, and certainly every
Of
surgical
course.
field is so different. When I look at a transplant surgeon, that you're
Right.
like, organs are so precious. They will do anything to keep those patients alive. Sometimes, I mean, I certainly had
Yeah.
stepped on some toes in my fellowship with the transplant surgeons. Cardiothoracic surgeons, very similar, just doing these insane procedures.
Right.
Um, trauma surgeons are a little bit of a different breed. We don't really have an elective practice. We take what comes to us and
Yes,
we take
true.
it.
And it's
We
so varied,
Yes,
probably.
and we just kind of take it and we try to do our best with it. And I think what many trauma surgeons are good at is holding hope, but really also trying to paint realistic pictures. And certainly,
Yeah.
early in my career, I was actually more of a pessimist. I think I thought everyone was going to die. And, I think I learned from some of my older partners, like, stop giving up so soon and like hold
Yeah.
space for the miracle to happen, or for the
Yeah.
not even a miracle, maybe for the body to just figure itself out. And so now
Yeah.
I'm a little more balanced and like nuanced
Yes.
in my approach. But regardless, I do always paint the full picture, because I think it's really important to remember, and this is so much part of palliative care, is it's not just about whether someone will live or die. It's what
I
that
know.
life is going to look like. What is their functional status? What is their quality of life? And also, we need to be realistic. Like, if you came in at, say, level 5, you're never going to be at level 10. You're only going to be lower than the level 5. And so one of
Right.
my favorite questions to ask every patient is, tell me what life's been like in the last couple of weeks, or ask their family, like, where's our
Yeah.
baseline here, so that we
Yes.
have appropriate goals.
Yeah, so important having that perspective too. And I appreciate you clarifying too that the very nature of trauma surgery means the way that you're having to approach, your interventions is different because it's, sort of coming in at you in these very
Well, they're
unique
coming in
ways.
broken, and you're not, I mean, this is not elective on any level. They're very
Right.
broken. So,
Yeah, yeah, and you're having to react so
yes.
quickly. So here you are having all of this training where you have personally experienced this trauma and this death, grief and death loss in your life, certainly through all of your fellowship and your internships and your early medical practice, you are witnessing and seeing both being present to the saving of lives, but also the death of patients, presumably, on your table, and then the families in the waiting rooms
Yeah.
and the aftermath. So in some ways, you're maybe building a musculature to this. And yet this is also probably through a little bit of a professional lens. There's probably some way in
Separate,
which you
yeah,
have to
distance there. Sure.
separate and
Yep.
distance. And then tragic loss and traumatic loss came at your
Yeah.
door literally
S-
again.
I
Yeah. Do you want to tell us a
actually,
little bit
yeah,
about?
actually wrote an essay called Trauma Comes Home about it. But yeah,
Yeah.
my life was in I think a relatively, like, really, at least my professional life was in a relatively good place in September of 2020. Just, although it was a scary place, like with COVID in the hospital.
Yes, of
But on
course.
September 28th of 2020, my partner, Brandon, fell off a ladder at work and hit his head and suffered a traumatic brain injury, or a TBI.
Okay. Yeah.
And, traumatic brain injuries are classified as mild, moderate, or severe. And I think by most people would have said he had a mild traumatic brain injury. But
Okay.
what I say is, man, I was a trauma surgeon. I'd say be 40 to 50% of my census on any given day is mild traumatic brain injuries, because a lot of older people fall and hit their heads.
Yeah. Yeah.
And yet I had no idea what happened when these people left the hospital. So my partner was in and out of the
Mm,
hospital and rehab for the next 5 weeks. And when he came home, I became his caregiver. Every system of his body didn't function correctly anymore. His vision was changed. He lost his sense of smell. Therefore, he lost his sense of taste. He had headache. He had occipital neuralgia, which is related to
oof.
trigeminal neuralgia, which is called the suicide disease. Ongoing
Mm.
pain in
Horrible
his head,
headaches. Yeah.
24/7. Had all this weird body pain. Had no balance, so was falling. I mean, yeah, became his could do some of his
Full-time
activities
caregiver in a
of
way.
daily
Yeah.
living, but I did a lot, I did a lot of stuff for him. And I Had never been a caregiver before. I was, I think, a wonderful medical advocate. He went to over 150 appointments, including like all his physical therapies before he died. And I actually do not like that whole fighting and warrior approach to disease, but I will say
I
I
hate
hate
it.
it.
And
However, I lived with it, and I will say he did everything he could to get well.
yeah,
He never
yeah,
gave up.
yeah.
Um, but here's the messy part of all this. Our relationship had a lot of issues before this, and then suddenly I'm stuck being this
Which
person's
happens so
caregiver.
often,
Yes, which we
right?
don't
And it
talk
makes it
about.
so
Yeah. Yeah.
complicated. Yes,
I'm like,
yes, yeah,
but I had promised myself I would care. I just decided I would care for him for a year. I
yeah,
wanted to give him a year with me because I felt like I could be a great medical advocate for him. And we went to a lot of different doctors and did a lot of different therapies, and yet he was not getting better. He was it. I'm sure you can relate. The up close and personal, like witness, being a witness to that intensity of suffering
yeah.
was the most painful thing I'd ever experienced. I mean, I just used to daydream about someone coming to extract me from my life. I used to daydream about not waking up. Then I daydream about him not waking up. Like, I mean,
Yeah,
we were stuck in
yeah,
our misery. And
yeah,
it just wasn't getting better. And then on April 30th of 2021, after a very vicious fight, because again, just messy life stuff. Like I just
yeah,
found
yeah.
out that he had been finally like had proof that he had been unfaithful to me. And
Oh my goodness.
yeah, and I, said awful things, but awful that you would say to someone who you just,
In the
yeah,
case of, yeah,
yeah,
finding out the betrayal.
right.
Yeah, okay.
And I think it was kind of the last straw for him. I said, you have to go home to your parents. There's no way I'm doing this anymore. And he went outside and shot himself to death in our shed. And I
Oh,
heard that gun. I heard that shot. I knew what it. I have heard gunshots before, so I knew what it was. And I went outside and found him actively dying. Yeah, and there I was again. I mean, I know it sounds so cheesy, but like I got scared. I like was like, what am I seeing? So different than
yeah,
being a trauma surgeon. I see suicides completed and not completed all the time in the trauma bay, but to be on the
yeah.
scene in your own backyard was
With
it was
someone you know, again, it's
yes,
different. That,
yes,
like, to
yes,
be a trauma
yes.
surgeon, 2 things to be a trauma surgeon, I mean, 1, they're coming into your house, as it were. You're in the
Right.
surgical space. It has a medical kind of cleanliness to it. Not that they're not clean. I mean, they're coming
Right.
in
Yeah,
all
yeah.
states. But it's they're a stranger to you, and it's sort of in this place where you have your professional hat on, and here you are, somebody that you've loved, at
Yep.
least, in
Yeah.
the past, if
And
not still
cared
love,
for.
and cared for, and had cared for, literally, physically, metaphorically, and was in your space, was in your
Yeah. And
space, which just reminds us, like, you can't, there's only so many things you can prepare for.
yeah. And I ran, I did run.
Yeah,
I just like
yeah,
ran away, called 911. But as I was walking back, I did say, Red, this is not your fault. And you will make meaning out of this. I really did say that to myself. Like, I was like, girl, you've already been here. I just started talking to myself right away. You know this. Like, you're going to
yeah,
get through this.
yeah,
I don't know where that came from, except that I had done a lot of work around my dad grief over the years. And like, I was like, you're going to get through this. And, I'm always grateful that he died rather than survive to go to the hospital because I mean my trauma team like knew about it almost immediately and like I think that they certainly I didn't want them to be on the receiving end of that. I didn't want to have to make any difficult decisions and
yeah,
I just think in that situation I just thank God there was not any more suffering because
yeah,
I see it on the other side and so yeah
yeah.
it
I
was
can imagine you.
very challenging.
Well, and there's so many layers, which we don't even have time to unpack
No,
today,
you
but I
see,
think there's, but
talk about being too much.
no, it's not too much, but I wanted to
Feels like
name a
too
couple
much.
of things that you just said to me. Well, first, I just wanted to hold space for Brandon, and also for you to have to come across all of that,
Yeah.
in the span. But in particular, what I guess I wanted to name and draw out is the complications, of course, that happen when we're grieving a traumatic death, whether it's like the murder of your father or now the death by suicide of your boyfriend or partner, who you also witnessed, not just you heard about,
Yes.
but that you witnessed. But also this other layer, I think of the conversation I had with Steph Sarazin around ambiguous loss, particularly around betrayal. So here you were
Yes.
also just coming to grips with, and not even coming to grips, but the beginning of, right? So
Oh,
this is
yeah.
very compounding cumulative grief, but also there was this active death loss, which was its own thing and traumatic. But I don't think we talk enough about the grief over the loss that we have when we learn of betrayal, because the life that we thought we had was not the life that we had. And so I just wondered, in the intervening years since his death, have you attended to or sort of thought much about that part of your grief? Not that it's really separate from, but distinct
Yeah.
from maybe the
I,
death
you know,
loss.
I gave myself permission to talk about it. Like I will say I love my family, my like whole immediate family so much because I did not hide any of this from them.
Okay.
I mean,
Yeah.
I got phone calls from two women the night that Brandon died looking for him.
Oh, wow.
Okay. And like we
Yeah.
actually all cried together. I was like, talk about trauma bonding. I mean, I cut that off real
Right.
quick, but I was like,
Yeah.
I listen, I'm like, I actually can give this man a lot of grace. He was human like everybody else. And we've
Yeah.
all made crazy decisions in our lives. Um,
Yeah.
but I did not hide this from my family. And what I love that my family was able to do is they loved Brandon anyway, and they grieved with me, and they never put me in a position to have to, like, they never said, "Oh, what an ass," and all this stuff where I had
Like,
to,
he's
where
not
I
worth
had,
grieving over,
right,
which I've heard
where I
from
would
people
have to
before.
defend
Yeah.
him even though I was angry at him. It was
Yeah.
great. They just kind of said, "Okay, that was that, and this is also really sad." And that's kind of how I held it. Like I've had to do some certainly a work in therapy around trust and all of that. And I certainly talk to my current boyfriend about it a lot, because
Yeah.
it's definitely a broken trust. But it just was like, I just had to accept, like, he was just like a human being, like everyone else. And
Yeah.
especially, I don't love all the stuff he did turned out for years, but certainly the last 7 months of his life while he was in tremendous suffering, I let all that go because when we're suffering, just like when I was suffering over the grief of my dad and I was acting out
Yeah.
and eating disorder and all
Yeah.
this, Brandon was just trying to self-soothe in the few um, ways that were still available to him because he couldn't
Yeah.
leave, he couldn't leave the house, didn't have a lot of like his own money, all this stuff. Like he was just trying to do his best. And
Yeah.
in
Yeah.
extending that grace to him, I think I shared, like, I've been able to extend a lot of grace back to myself.
Yeah. That's, oof. I just want to hold that for a minute. I think that's so powerful. And if you're listening and you're in a season of your grief that's around betrayal and you don't feel like you have grace to give, that's okay. We're not
Hmm.
here to preach, but I think it's important to name that. Actually, I think when we feel unseen, we're desperately clinging for people to have grace for us or for us to have grace for ourselves while denying it for others. And I actually think what you just named was so powerful. Actually, when we're able to extend grace to other people, we can see our shared humanity, and then we can actually more truly, deeply, I think that's been my experience, allow grace for ourselves. And I wonder
But I'll
if
share
that
with the
sounds like your
listeners, I
experience.
was pretty effing pissed off for
Yeah.
a long,
Yes.
long time.
Yep. Good.
And I
You see
still
both
get
and.
really mad.
Yeah.
Yes, yes. I'll still
Yeah.
have some really nasty conversations with him.
Well, and I think that's the ambiguity again, like that so many of us try to name, that I think is important to push back against the cultural language of the binary, and which is like, I can grieve someone that I both loved and hate or am angry at and feel anguish over, and, you know, all the things. And actually, it's the permission for whichever was more present in any different season of your grief to be with whatever that is and to lean into or be curious to the anger that's coming up towards this person, but maybe the sorrow now in this season, and to just
Yeah.
allow it to move through you in that way.
And again, the biggest thing, and I think this is so good for the listeners, if you're supporting someone in one of these messy situations, is, if we can avoid putting the griever in a situation where they have to defend the behavior, like
Yeah.
that would have been awful for me. I didn't have to fight about whether he was an ass or not an ass. He just was who he was. And we were all very sad that he had suffered and died. And both of those things can be true. And if we can hold that space for others who are trying to work it out in their own heads, I
Yeah.
think like it'll go a long way.
Yeah. I think that holding the both and there, which listeners know is sort of one of my many favorite themes, is so powerful. And to recognize what you said, that even if it's coming from a good intention, because I think often, I wonder if you experience this, doesn't sound like with your family, people don't want to see you suffer in grief,
Yes.
regardless of what the source of your loss is. But they think, well, if I can just convince you that he was a jerk, not worthy of grieving over, I'm using air quotes, if you're, for those who are listening on audio, not watching on YouTube, right? Then I can reduce your suffering, because then you don't have to grieve because he was a jerk, or
Right.
whatever label we call them. Except it's not that clean. And then, as you said, it puts the griever now in a position of having to be on the defensive, to take a side that they don't necessarily even want to take, but
Exactly.
feel they have to. Yeah.
Yeah. And
Yeah.
it's very similar for just suicide in general, whether there's betrayal or not. That whole idea of they were so selfish. Like, I would just
Yeah.
say, let's not say
No,
they
let's
anything.
never.
Yeah.
Yeah.
Yep. The issue was they were suffering. And
Yeah.
I hope
And they
that,
didn't feel like they had any other
yeah.
choices.
And that's the end of that story. And I will say, not many people said awful things to me because I joke like, here's my community, trauma and palliative care. Like, could you get any more comfortable with
I mean,
like
hopefully
awful
you had,
deaths?
yes.
Yeah.
Yeah.
I was very held by many, many people. Um,
Yeah.
but the few things that stuck out to me were how selfish he was. And I just was like, first of all, you didn't even know him. And second of all, I
Yeah.
think that is just a very, I rarely say things are inappropriate or you shouldn't say them, but that's one of them
Yeah.
we probably should let go of. Yeah.
I think we should. You know what? I am a should detective, and I wrote about that in my book. And I think should causes us so much suffering, but I think there are a few hard and fast rules. I think any sentence that starts with at least,
Yes. Oh,
we need to
yes. I love
eliminate.
that.
Any sentence that starts with at least when we're talking to a griever. And I do think that, because I think really in the end, what we want to do is come back around to see, with that self-compassionate lens, that I think about, like Kristen Neff talks about, which is just, this is the human experience of
It
suffering.
is.
And we all will do whatever we can to reduce our suffering. And so it's just more incumbent on all of us to attend to and recognize our own experience in suffering so that we can recognize others, and vice versa. And to just, the language of selfishness is also a way to bypass the feelings.
Yes.
It's just another way to be like, oh, well, we can, instead of really coming to terms with our own sadness, or if you're somebody on the outside looking in, or just the fear that we all have that, like, there's got to be a reason so that I can explain away this tragic thing so that it's not going to come knocking on my door.
Yeah.
And so we can just label somebody selfish, and then, but that's, not going to touch me. I think it's a way of trying to distance in a way that is just a bypass to
Yeah.
attending to the very human experience.
Yeah.
I say this every time, but it's true. I don't know where an hour goes. Every time I sit down to hold conversation with my guests on this show, and Red Hoffman, this has been truly important and profound. And I so appreciate your willingness to just walk with us, and allow us to walk with you along the messy and the inspiring and the hard and just all the lessons that it means to navigate these losses, particularly these losses that involve trauma and death and betrayal, and giving us some insights professionally and personally on how you have come to see the world as you've navigated this path. Yeah.
All right. Well, I so appreciate your time. Can I leave your listeners with just one thing? I just,
Yes.
want to share it towards in this grief journey, a couple months after Brandon's suicide, I started thinking like, how do I describe myself? I'm someone whose dad was murdered by a terrorist and whose boyfriend shot themselves in my backyard. And that's really how I came to this work around like being a survivor of violent loss. And I just want to put out there that, at least 50% of Americans have survived at least one violent loss, which is
Yes.
kind of defined by a death as a death due to homicide, suicide, accident, or a disaster. And that um, it's a different loss. And I would just ask that maybe people just start, even if you just Google like being a survivor of violent death, you'll find
Yeah.
different things. I think that it I don't like the word, I'm not talking about complicated grief, but I'll just say it's
Yeah.
complicated and messy because it often
Yes.
involves law enforcement, the media, and the legal system in a way that natural
Yes.
deaths don't often do so. And I think
Yeah.
I want to put it out there because I want survivors of violent death to know it's like it is a different beast. So if you're feeling othered, that's probably why. Because if someone else
Yes.
hasn't had this, it is normal to feel different. And for those of you who like love a survivor of violent loss, like I said in my TEDx talk, like be patient because
Yeah.
not only did we lose someone, but we lost a real, makes me weepy, like a real basic sense of safety in a very scary world. And it's like
Yeah.
two losses. And to just kind of be really, really patient with people and know that there's a lot of layers going on there.
Yeah. Let's spend some more time together. Our listeners are going to stay with us for a few more minutes because I think I appreciate you inviting us to um, bring our awareness to the nuance and the difference when it comes to surviving, a violent loss. And so I just want to attend to that a little bit more. And I think what I hear you saying, I just love to hear a little bit more about it. Of course, we're not in here comparing your loss is better than my loss or
No,
easier or whatever, but and so importantly, helping us if we haven't experienced it, if we're a listener who hasn't experienced it, the different complicating, and I agree, it's not about the label of complicated grief, but these kinds of losses are complicated and have complications because you have to turn on the news and see, many of us, if we had a loved one die in the hospital, we're not going to accidentally turn on the news and see the story of our loved one or their murderer, right? We have the legal system. We have all of these different layers
yes.
that we have to navigate in that, especially in those early seasons of grief where everything's already a fog, but now you're having to claw your way through all of these other layers. Yeah. I think
Yes.
that's really
I didn't mean to interrupt you. I'm sorry.
no.
But I was thinking maybe I can give you just a link or two because I think like
Yeah.
the work of Edward Reinerson, I'll send you some stuff because
Yeah.
I
We'll share
think
this in the show notes, folks, for
yeah,
sure.
he really kind of helps break down why being a survivor of violent loss
Yeah.
is different, and I love what he does. He talks about that there's two different in the emotional part of it, like there's this separation distress. That's the distress we all feel when someone we love
Yes.
dies, and it's all about longing and wanting to be with them and all these,
The
just
homesickness we feel.
yes.
And yeah.
But then there's this traumatic distress, and that's really more about replaying or what happened or what we assumed happened. We got real obsessed with those last moments, which can cause a lot of
Yes.
angst and potentially PTSD for people. And there's a lot of fear around that. And then you're almost trying to avoid those feelings because you're trying to protect yourself. So you have this separation distress and traumatic distress playing out
Yeah.
in the same body, and it
Yeah.
is really
In
like
a culture that doesn't
painful.
not know how to attend to either well.
Yes. Yes. And so
Yeah.
so that's the emotional part. And then we said then there's just the real life part, which is really dealing with those three things. The legal system, like I really thought they were going to come and arrest me because I didn't try to save my boyfriend and I'm a trauma surgeon. I mean, this is like
Yeah.
I work with law enforcement all the time. This is like what
Yeah.
this is what I'm thinking. So I wonder what
Yeah.
other people are thinking. And then
Yeah.
the media is awful, cleaning up your house, cleaning up the mess.
Yeah.
You know what I
Just the
mean?
logistics
Like
of
it's just things
yeah.
you don't really think about. And then the legal system, having to get a lawyer and all that. I mean, it's like it's overwhelming, it's expensive, and again, it can feel very isolating.
Terrifying, isolating, and I can also imagine it's just more layers that keep you from starting
Yes.
to do the quote unquote work of grief because
Yes.
being, some of us can relate to it again with oh, I have to deal with the estate, or there's an argument
Yeah.
over the thing, but right, which can also distract you from,
Yes.
sort of being with your feelings. But now you've got these layers upon layers upon layers, which is, again, I can imagine when you're a survivor of violent loss, like the prolonged nature of even beginning to unpack or soften into the depths of your grief is,
Yes.
prolonged because of all of these layers you're having to navigate that some people experiencing other kinds of death losses aren't having to navigate. Yeah.
And I loved what you said, Lisa. It's not about comparing at all, because you know what?
It's
Like I
just about being
share,
aware of the
yep,
differences. Yeah.
that's all there is. There is suffering everywhere, but it's just to be aware, and just to,
Yeah.
like, my hope is just for others, again, for people who love someone who survived a violent loss, just to kind of understand the different varieties of this loss, and what people are kind of asked to attend to, especially, again, early in grief, when you really have minimal capacity to deal with anything, and suddenly you're like dealing with a lawyer. I mean, like,
Yeah. A
I don't
lawyer
know,
and
that
police
world,
and yeah.
yeah,
Yeah.
so
Yeah. Well, and yes, I appreciate you coming back around to that. And I think it is really important for all of us. I have folks who listen who are also fellow folks in the grief space, or just individual grievers, and, physicians, all kinds of folks listen to the show. And I think it's just a reminder for all of us, even myself, who works with individuals, one-on-one, which I have in various capacities in my 20 plus years as a social worker, that we might know something about grief. And yet it's important for us to recognize that maybe we haven't understood the particular unique circumstances, which is always the case of every
of
individual
course.
griever, but then these kind of common circumstances and layers that happen. And so we might invite ourselves to pause and to get curious. And I think your words today were just such an important gift to all of us, again, whether we professionally or personally, which, given this 50% statistic, means we likely will encounter or be one of those people, to just have some extra grace. Back to
Yes.
that word, extend some extra grace, um, to ourselves and to the folks that we're supporting, in this unique journey. I recognize our time, but I think I don't want to end our conversation without touching on this other piece that you brought up, which I think is so important in the wake of any kind of trauma, and particularly a traumatic death and traumatic grief, which is the loss of a sense of safety. That feels really particularly important to me. I've shared before on the show, I'm an early survivor of rape as a
Yeah.
teen, and went through some trauma around my late husband's misdiagnosis and death. And I have definitely been a person who's been working on my trauma for 30 something years, but my hypervigilance and the loss of safety wasn't really something that I learned to grieve, actually, until probably the last 8 to 10 years, right? I didn't really understand the loss of not being able to be in fear of the world. I mean, I've tampered it, but like that the loss
Yes.
of a sense of safety in the world, which presumably started for you, right, with the murder
Yeah.
of your father. And just, what do you think we don't get, or what do we not talk about enough around the loss of that trauma results in this loss of safety in the world?
Well, I'll say a couple things. One, I remember after my father died, standing at the kitchen window about to take out the garbage, and thinking I was hearing gunshots. I mean, I was living in South Florida. I could have been hearing gunshots, but like,
Yeah.
I didn't know how to put that two together, but it was certainly related. That, and then being
Yeah.
scared to walk to work. And
Yeah.
I just felt scared in the world, which made no sense. My father was killed in Cairo, Egypt. Why am I scared
Right.
in South Florida? So I
Yeah.
think, one, just recognizing that it doesn't have to make sense, but it happens.
Yeah.
Because what was fascinating
Because it's
for,
not happening in the
right.
logical brain, right? It's
Yeah. Yeah.
happening in the nervous system.
Yes.
Yes.
What was fascinating for me, and I explored this with like my therapist after Brandon died, was like I had that same sense of that loss of safety after his suicide, which I found kind of fascinating, because this was by his own hand. It's not,
Right.
it's yet I felt like, wow, how wild to live in a world where someone I loved had this accident and then suffered so much that he like shot himself, 50 feet away from me. But
Yeah.
what I'll say is I think in today, like in this day and age, is like most of us, we're all living with that because the world is really scary. And
Yeah.
so, again, just how like I had this weird reaction in South Florida to something that happened in Cairo, Egypt, you or your listeners may have this like
Yeah.
weird reaction sitting in the middle of America to something that's happening in the Middle East or 10 states
Yeah.
away or whatever. And like, don't judge yourself. Like the stuff's
Yeah.
real. It does happen. It is a scary freaking, it's a scary world. And I think, just like naming it and just like not judging it are for me the two biggest things. And because of course, once those happen, then I can start feeling the feelings around it too.
Yeah. Yeah.
And then I will say too, I think as we name it and talk about it, like I always say, I think time really smooths away the rough edges and the world, at least around like Brandon's death, feels a little less scary today than it did,
Yeah.
three
Yeah.
and a half years ago.
Yeah.
And so I think like don't give up on that time. Like it does smooth out the rough edges. It really does.
Yeah. Well, I appreciate you naming a couple things, which is like to not gaslight ourselves into, trying to apply logic to something that's really instinctual at the nervous system level, that we can feel a kind of unsafety when we're bombarded on the news by stories of things and maybe even people we don't know, let alone having had our own personal stories. And yet we don't need to let that go unchecked. So how do
Yep.
we recognize it? How do we name it? How do we use whatever practices and tools, use that musculature that I've been talking about to soothe our nervous system so that we're not walking around in an activated state of fear all the time, which is not good for anybody around us nor
Yes.
ourselves. And then allowing, I time heals all wounds is a bunch of BS, and time gives us the space to practice cultivating being able to carry the weight of grief, to be able to allow us to carry, the fear and to metabolize the
Yeah.
experiences that we've had. And so to just, but it takes us one foot in front of the other. And I would say, if you're listening and this is resonating for you, making sure, I always argue, if you have experienced something, around traumatic grief, make sure that you are finding somebody who is showing up with the tools and resources to attend specifically
Yes.
to the kinds of experiences that you're having, which could be in addition to a typical grief support group or some other resource, or instead of. I think, it can be certainly additive, but to make sure, because what we don't want is for somebody who's experiencing traumatic symptoms or feeling that real loss of safety and that hypervigilance in the world, to go, the longer you go unattended to, the more difficult it is to unpack, I think, later
Mm.
on. So to offer that intervention as early as you can, I think. Does that sound
I
resonate to
mean,
you? Does it? Yeah.
100%. I was in therapy 6 days after Branda died, and it was the best thing I ever did. And
Yeah. Yeah.
with the right therapist, and if you have,
Yes.
and I recognize that that is like a gift that not everyone has, but if it's
Yes.
available like early and often, it doesn't have to last forever. I'm not in therapy right now. I
No.
did a lot of work in
Yes.
in a 2-year period, and I'm like, okay, I can take a break for a little bit and then do something else.
Yeah, yeah, awesome. Well, for now, I'm going to
Thank
say
you.
thank you so much, Red Hoffman, for joining me on Grief is a Sneaky Bitch podcast. I learned so much. I know our listeners did too, and I just appreciate your time and your wisdom today.
Thank you so much for having me, Lisa. And honestly, I just want to thank you for holding space for that story that, even as I told it, still feels like a little too much. So thank you to you and your listeners for listening. And I just appreciate the work you're doing so much. It was such a juicy conversation.
It was. Thank you so much.
Thanks. That was